Hi everyone, my name is Lacey Peters and I'm the Health and Physical Education Specialist with the Nebraska Department of Education. I would like to give you just a brief update on the health education standards that are currently being developed by NDE. So to look at the overall structure of all content standards, Nebraska's process utilizes a wide variety of educators from K through 12 to post-secondary institutes. We look at geographically diverse individuals, making sure that we have rural and urban communities all across Nebraska represented on the writing team as well as the editing team. With this, we review and utilize a variety of nationally recognized resources and best practices, as well as research and surveys that may be available at the state or national level, as well as skills needed for the workplace. And all while doing this, we try to maintain ongoing communication with the State Board of Education and the State Board subcommittees. Public input is also taken into consideration through this process. So this is a general process. I will be relating and speaking more specifically to the health education standards process here in a little bit. Just a reminder that standards just create a framework for students to learn those basic health information, resources, and services that are available to maintain and promote lifelong health. So this is not a curriculum. This is not mandated either. This framework just allows schools to create a curriculum or adopt a curriculum and serve as guidance, essentially, to teach a comprehensive health education program. So we mentioned that we utilize Nebraska teachers for this process. And an advisory team was pulled together prior to the writing process to kind of look at that workplace, what is necessary out in the field. Mainly it was made up of medical professionals from a wide range. We had nurses, school nurses, state school nurse consultants, OBGYNs, orthopedic surgeons, pediatricians. There was a psychiatrist, school counselors, school psychologists. There was a wide range of medical professionals, as well as community health educators and content area experts, whether they be from foundations or public health venues that focus on specific content that is taught in health education. We had local health departments kind of fall within that. Some Nebraska educators or district level coordinators, as well as administrators, registered dietitians, and professors and researchers, mainly in the areas of social emotional learning, mental health, and physical activity and health promotion. And then there were some parents as well on this advisory team. So the advisory team had about 35 or so people on it, and their suggestions were then taken to the writing team. The writing team was comprised of your educators. So we had middle and high school health education endorsed teachers. We had health and PE teachers at all levels. We had some from private schools to public schools. We also had family and consumer science teachers represented, as well as district level health and physical education curriculum coordinators, school administrator, as well as an ESU board member, who are all part of the writing team. Again, geographically located all across Nebraska, from northern to southern, east to west, rural to urban. And there were about 25 people on the writing team. So with that said, the health education standards drafts that are being completed now took research and best practices for health education into consideration. Many of these are national documents, whether it's from CDC, Shape America, additional organizations. But then we also looked at what other states did for health education, for those who have health education standards already adopted. We examined statewide data and trends in health education. So looking at YRBS data, which is the Youth Risk Behavior Survey, Youth Tobacco Survey, as well as the risk and protective factors. We also looked at the school health profiles, and then an additional survey was implemented to schools to examine how health education is offered and what content is typically taught across the state of Nebraska. So all of that data was then utilized to write the standards and come to some of the decisions that we did, which I will share with you in just a little bit. So with all of that data, research, and best practices, as well as the feedback from the advisory council, the writing team determined critical topics or concepts that needed to be taught. And then a huge vision or piece of this whole thing was ensuring that equity is incorporated throughout the standards. So with that, the writing team came to the decision to include 8 content strands. The strands are listed right here. So Foundations of Personal Health is meant to assist students with acquiring basic health concepts and functional health knowledge and skills, providing a foundation for promoting health-enhancing behaviors. This strand includes essential concepts that are based on established health behavior theories and models. These concepts focus on both health promotion and risk reduction. Through the development of the foundational skills and knowledge, for example, communication skills, resiliency skills, protective factors, goal setting, decision making, stress management, etc. The subsequent content strands will build upon these and further cultivate these skills for student health literacy. Consumer and environmental health is then one that focuses on teaching students how to identify and access valid consumer products, services, and resources for a healthy lifestyle, and recognize how the environment plays a major factor in one's overall well-being. Students will develop an understanding in health-enhancing behaviors for community engagement and utilizing supports within their community. School-based consumer health education is a big component to prepare current and future consumers to safely and efficiently advocate for oneself and utilize the medical marketplace. So those consumer products, services, and resources for a healthy lifestyle. Disease prevention is just that, and right now it is a major topic. This promotes hygiene and safety practices to prevent and reduce the risk of diseases and conditions. By understanding what a disease is and how they are transmitted and or acquired, students will learn and adopt behaviors which will maintain and enhance their overall health. Social, emotional, and mental health is another strand. The social really focuses on those relationships, but this strand overall will help students understand diverse cultural experiences that impact mental, emotional, and social health. Students will learn strategies to help manage their thoughts, feelings, emotions, and behaviors, learning how to cope with change and stressors and recognize when support is needed for self or others is a key component of this strand. Students will develop positive social behaviors that provide them with the skills to get along with and assist others. Social, emotional, and mental wellness are key elements to one's overall health and well-being. Nutrition and physical activity will look at those lifestyle choices and promoting healthy choices through knowledge and skill development to properly fuel the body. Students will learn the importance of movement and dietary choices along with their effects on the body, academics, and overall health. The link between nutrition and physical activity and learning is well documented. Healthy eating patterns and physical activity are essential for students to achieve their full academic potential, full physical and mental growth, and lifelong health and well-being. Injury prevention and safety will assist students in understanding their role in protecting themselves and others from unintentional danger, risk, or injury. Additionally, students will develop skills to recognize and appropriately respond to injuries or emergency situations. And right now, we know in the United States that injuries are one of the highest leading causes of death in children and adolescents. So that just emphasizes some of the importance for that strand. Substance abuse prevention provides students with knowledge and skills to make healthy choices to avoid or reduce their risk of substance abuse. For example, alcohol, tobacco, nicotine delivery devices, other drugs, both legal and illegal, and medications. So students will learn the difference between harmful and helpful drugs and medication, along with short and long-term consequences of use, misuse, and abuse on overall health. And the last strand is human growth and development. This strand teaches students the structures and functions of the body systems and how to recognize and manage the physical and psychological changes that occur during development and maturation, experienced throughout the lifespan, so birth to death. Students will recognize characteristics relating to identity, sexuality, and healthy relationships, and identify the fundamental components of sexual health. So again, you will see these 8 content strands appear throughout the standards K through 8. Standards are subject-based K through 8. So kindergarten has a set of standards, first grade has their own, second grade has their own. So they're not banded. And at the high school level, they are course-based standards, and there are 2 health courses that have been identified and descriptions provided as well. Just to give kind of an overview of the timeline and process, Draft 1 will become available for public input, where you guys will have the opportunity to see these, comment, and provide any feedback or input relating to draft number 1. Editing will then take place. It will go through a bias review before it is approved. Tentative date for approval by the state board is fall of 2021. And if you visit the Nebraska Department of Education, Physical Education, and Health Education website, you will find a link that has a page with all of the updates. As we update the State Board of Education, those updates will become available to the public as well. So that website will be periodically updated to reflect that information. Thank you for listening to this update. If you have any questions or concerns regarding the health education standards process, feel free to email me at lacy.peters@nebraska.gov. Have a great rest of your day.